Hi, everyone. Welcome to our final webinar, How Can Health Considerations Drive Climate Action? I'm Harshini Ramesh. I am a research associate with SPI, and I'll just be the MC for this event today. Before we do get started, I wanted to kick off the event with a land acknowledgement. So I would personally like to acknowledge that I'm calling in from the treaty lands and territory of the Mississaugas of the Credit First Nation, as well as the traditional territory of the Huron-Wendat and Haudenosaunee people. So this Tuesday, we heard the speech from the throne, and it highlighted the importance of building a cleaner and healthier future. To build a future, or a better future that is, it is imperative that we learn about our past. A land acknowledgement is just one of many actions to confront history and learn the lived realities of Indigenous peoples. So I would like to invite everyone to please join me in reflecting about the history of the land that you're joining us from and what actioning reconciliation would look like within your communities to build and work towards a collectively better future. Thank you so much for reflecting with me. So once again, welcome to our third and final event in the health series. So today's event is going to be a little bit interesting and a little different. So we're going to kick off the event with a 5-minute overview provided by my colleague, John McNally, who will give an overview of our recent work on the intersection of health, climate, and the economy to give a frame for the following discussion, which will be between 3 incredible panelists. Through the discussion, we also welcome audience questions throughout the hour, so please feel free to submit your questions in the QA box, which you can find at the bottom of your screen. So without any further ado, I'll just pass the mic over to John McNally, who is a senior research associate leading the Clean Growth team at SPI, and he'll be moderating today's discussion. Over to you.
Thanks, Harshini. And a huge thank you to everyone for coming out to engage with us on this topic today. I'm personally really excited to be here, and I want to stress that the lack of actual fire in our fireside panel chat is not going to deter us from getting cozy. So I want to start off by framing this discussion by offering 3 points that lend some context to some of our ongoing work at SPI and highlight the reason why we feel that this discussion is so exciting and so timely. For those of you who might not know, over the last year, Smart Prosperity Institute has been working on a series of reports, events, and knowledge translation pieces about the intersection of health, climate action, and investments in nature-based solutions. Over the last month or so, we've released 5 public reports that offer deep dives into the intersections of these issues through a number of different perspectives. This work has touched on discussions of health from exposure to pollutants that emerge from fossil fuel combustion, discuss the benefits to a host of environmental factors that emerge from spending on low carbon infrastructure, climate-friendly projects, and nature-based solutions, looked at some of the challenges for valuing the health benefits of nature-based solutions, and I aim to unpack some of the valuation and assessment processes and metrics that come from thinking about the health impacts from a given low carbon infrastructure or natural solution project. We're really proud of it, and I recommend that you give the reports a read if you haven't had a chance already. Our overarching reason for wanting to think about this issue is pretty simple. For most of the project types that we advocate for and champion as a clean economy think tank who talks a lot to the federal government about the importance of climate action, we recognize that there are very real health benefits associated with these projects. And more readily discussing and advancing these benefits is one way of showing that investments in climate action can offer improvements to people's quality of life beyond just broader efforts to mitigate emissions and combat climate change. We know that investments in electric public transit vehicles and urban parks can offer very material benefits to individuals for their mental health, or it can improve air quality in a way that's quite real and has positive impacts on mortality and morbidity outcomes. And we also know that they'll be experienced in every day by the community members who access them and who use these different services. The intersection of these 2 areas, health and climate, makes these 2 topics a natural fit to discuss together. And in the climate space, we often spend a fair bit of time acknowledging that these are adverse health impacts from the current system, but don't necessarily aim to explicitly connect those two dots in some of our spending or policy decisions. So we think that more concretely connecting these two policy areas would have a host of benefits. Number one, it could potentially build popular support for projects. It could help policymakers make more cost-effective decisions to achieve multiple objectives, and it can ensure that communities have the information they need to determine which projects or priorities make the most sense to them, given their emissions profiles and their health impacts. But if we want to do this, if we actually want to look at integrating the two sets of considerations, then we need to think about how that works. How can we integrate health considerations into environmental spending? What does success look like in this case? Are there examples of this integration being done really successfully in the past in particular campaigns or regions or projects? And what do we need to think about if we pursue this path? What are the barriers or challenges that might need to be overcome to meaningfully consider these two areas? So these are some of the outstanding questions that go beyond research in a report, and more importantly, research in our reports, and vary into the practical policymaking and advocacy spaces. And that's why I am so happy to welcome our three speakers joining us today for a discussion that hits on these themes and dives into these topics. So we have three great panelists joining today, and I want to sort of give each of them a chance to speak to themselves after I give a bit of an introduction. Dr. Anjali Helferty, who's the Executive Director of the Canadian Association of Physicians for the Environment, Gaby Kalapos, who's the Executive Director of the Clean Air Partnership, and Linda Varangu, who's the Senior Advisor for Climate Change for the Canadian Coalition for Green Healthcare. We're really happy that we get to have this discussion with all three of you today, since I know that you have a wealth of experience incorporating health considerations from a range of perspectives, whether it's helping think about how the healthcare sector can go greener, driving ambitious action across different levels of government, thinking a lot about decision-making tools and practical barriers, and supporting social change and really driving forward the public argument and advocacy case for these things. So I'd like to kind of start off with each of you, and we'll throw to Dr. Helferty first. But I want to start off with a big picture question, which is, what's one key takeaway that you hope each participant walks away with from this webinar and from this event?
Great, thanks very much, John. And you're totally welcome to call me Anjali for the duration of our event today and also into the future. So one of my reflections, being newer to the climate and health intersection, but having spent a lot of time in climate advocacy and now getting to look at how work is done on climate and health with slightly fresher eyes, is that when you want to make change, mobilizing messaging around a combination of a financial case, a health case, and constituent power is so key. So we can get these champions in government, and we can see some examples in the federal government today and governments at all levels, but that it's the power of a strong argument and a movement outside of government that enables those champions to make the big changes that we need to make, because we can't kid ourselves about the extent of transformational change that's needed to properly, or even come close to properly addressing these twinned issues around climate and health. There's big changes. So I think what I've learned and observed, and I think our other two panelists will also be able to speak to really, really effectively, and I can learn a lot from myself, is that it's been extremely clear that a health argument around climate change is effective both in mobilizing more people, bringing more people to the table, but also enables you to make a really strong financial case for the need for change, because both from a mitigations or emissions reductions perspectives, as John was just saying, there's huge advantages to health and cost savings associated with that. From an adaptation and planning perspective, we're seeing now really high costs to being unprepared for climate disasters. So we can, those are obviously personal costs felt by people, but they can be translated into financial, but into dollars and cents as well. And I think looking at this through a health lens provides a really powerful and effective way to make the case for the need for change. So I might just stop there. I'm sure we'll dig into more of these components over the course of the hour.
Those themes of building popular support and thinking a lot about the value of some of these changes are two themes that definitely came up a lot in our research, and I'm really looking forward to getting to dive into a bit more in this discussion. So Gaby, I know that your work has thought a lot about building support at this level. What's one key takeaway that you hope folks walk away with from this webinar?
I think one of the key takeaways that I hope people walk away from this webinar with is anyone or any business plan or value proposition that comes your way that says that acting on climate change is too expensive and we can't afford to do it is only because they've drawn the business plan bubble very narrow and they haven't included the health benefits associated with what we're doing. Never mind just the overall externalities and passing on costs and impacts to future generations. Never mind taking that into consideration, but even just a here and now business case with many of these issues, if they say that they can't afford to act on climate, it is only because they did not bring in health into their business planning decision making. And if they did that, the business case for it would be rock solid, and they need to expand the scope of how people look at building business cases for climate actions. I think that's my main point that I'd like to get across, hopefully through the conversation today.
That's great, and I think it aligns nicely with the point that Anjali made as well. Linda, I know that you've also got a lot of experience thinking about supporting the healthcare sector in making some of these decisions to sort of improve their sustainability footprint. Have you found that really integrating health and the sustainability considerations helps make the business case for these? Does that sort of align with the key takeaways that you're hoping folks walk away with today?
Yes, sorry, I was just on mute. Yes, absolutely. And we're seeing a lot of that evidence out west, especially in this today even. But when I think of healthy, resilient populations, I think of three main areas to focus on. One is that there's already a vulnerable population out there, and the vulnerable populations, as we saw with COVID, are the ones that are going to be suffering the most. And vulnerable populations, when we're dealing with how we can help them during these events, are also going to be the most costly. So if we put more resources into eliminating those vulnerabilities or working to get away from them, whether they are environmental based or whether they're social determinants of health and related to housing or things like that. That's a big sector for us to think about, not in terms of numbers per se, but in numbers of people, but numbers in terms of dollars. So it's a big impact. And so secondly, I think about the already healthy populations and how they themselves are going to be impacted by climate change. And so we're seeing that in BC as well. These are people who are fairly healthy that are also being impacted by mudslides and things like that. So we need a broader approach to protect these people, protect our populations from the vulnerabilities that come from infrastructure failure. And I think that's, again, that was a point I think Gaby and Anjali both made, in that we need a broader kind of community around this effort to protect that level of population. And thirdly, I think of the healthcare system, not just the sector, but the system as a whole, and the looking at it from the perspective of developing a sustainable, resilient, low carbon healthcare system so that we can continue to function when people need our help going forward in the climate scenarios that we're going to see. So if the supply chain isn't working, we're not going to get the products that we need to provide health services. If our health workforce is not resilient, if there's not sufficient number, if they're not trained in the right areas, we're going to have difficulty in dealing with the climate issues. So I kind of categorize it a little bit differently, but I think all those 3 points is from a kind of more of a healthcare perspective.
That's really interesting. And I think that kind of speaks to the systemic nature of the issue in question, thinking a lot about the folks who are affected, as well as the system that would aim to maintain good health. So I'm going to kickstart us with a question that I think the consultant in me is curious to know, which is when we talk about integrating different areas of public policy, one of the big questions that always comes up is, what does success look like? How do we know that we've successfully thought about health when taking climate action, or that we're thinking about climate when investing in our healthcare systems? And I guess in this case, I had a question as to, does success in your eyes look like emissions reductions? Does it look like improvements in health outcomes? Or is it simply one of those, you know it when you see it kind of things? And I'll, anyone who'd like to answer the question first, please feel free to jump in.
I'll kick it off. Yes, it's yes. It is such that we have to look at success in many, many different ways. We have to look at it from the perspective of GHG reductions, because ultimately that is what's going to keep us from having and exasperating this problem over the longer term. However, we cannot stay with just mitigation and looking at GHG reductions. We have to look at in terms of how it helps and helps to advance our resilience to extreme weather events, which are going to only become more extreme and more frequent. And in particular, we have a focus on our healthcare system, which at present is still very, very focused on treatment. And a lot of the needs and the climate actions are all geared towards very, very focused on prevention, preventing problems from happening in the first place, so you don't have to treat it and deal with it at the end time period. In many ways, climate change provides a mechanism for advancing the preventative lens that gets put to health, health kind of treatments or health kind of elements, so that we get more prevention into our system, which is still kind of geared largely towards treatment. And I think that's where I think climate really adds a really good synergistic element to it, is that it does push us down the road of preventing problems from happening in the first place, which is the cheapest way to deal with problems.
I totally agree, Gabby. This is an approach that is kind of unique in the health system, in the prevention side, from a healthcare perspective, but it lends that same model in dealing with the climate impacts in all the other areas that we're dealing with, whether it's infrastructure or natural systems. A preventative approach is intrinsically cheaper, but also saves more lives. And I think that's more of the perspective that we need to bring in as well. Whether it's morbidity or mortality, it's still going to be saving those concerns.
Yeah, I mean, unsurprisingly, I'm in agreement though. I think the only thing that I might add is, if we're thinking about measurements and we're thinking about data and how we're measuring emissions reductions or measuring health impacts, I think one of the things that I noticed in your reporting and that I think we need to see more and more is an emphasis on specific measured data. And to Linda's point, which communities are already experiencing lots of vulnerabilities, and doing some mapping around, regions that are more impacted. There's some obvious things, like people who live next to highways are already really susceptible to increased air pollution, and therefore will be more susceptible to other issues in future. And I think the there's a really deep need for specific data on who's being impacted by climate change, and then also who's being impacted by our mitigation efforts, who's receiving the adaptation efforts, and making sure that we're not exacerbating any existing inequalities, which is the default thing to do, because the default is for those in power to be making decisions that continue to benefit those in power. So it's working against a default that often seems to require huge amounts of data to make the case, which is, I think, an imperfect part of our colonial system, to think back on the land acknowledgement at the start, but that we, so much of a case needs to be made, and that we don't believe people when they say what they're seeing in their own communities. So there is, as a result, from environmental justice perspective, such a call for data collection. And I think it's unfortunate in a way that that's what's required, but it does seem to be really required when we think both about mitigation and offsets and that kind of thing, as well as on the adaptation side.
And if I could just follow up on Anjali's kind of point on that one with regards to the inequalities that are associated with almost all decisions that kind of have, if you don't apply that lens to it, to identify how you're making decisions and who it's going to affect, and if they're already affected negatively for many other kind of areas. One of the key things that's really been quite exciting over this last time period I found in the year and a half of kind of this COVID experience is how much more awareness people have to the need for us to work across our silos. Like we have our kind of GHG silo, we have our climate adaptation silo, the public health silo, the equity silo, the vulnerable population silos. And one of the key things that I think has been a little bit, well, actually it's been very exciting for me, and we've made a little bit of gains on it. Obviously, we're not where we need to be, is looking at and forcing ourselves to think across our own silos and applying a lens to our decision making. Something very similar is like community gardens that municipalities have in place. In many places, when they actually do a mapping analysis of their community gardens, they're finding they're in areas where there's plenty of ample private space for their residents. What about, instead of actually focusing it in those areas, what about focusing it in areas that have food deserts or have experienced food poverty or don't even have any private space, and creating balcony programs for them or community gardens that are geared towards people and prioritized based on the fact that they have no private space where they can grow food. Something very simpler can change, and now your programs are able to serve an audience, or you're at least being more conscientious about who your programs are serving and who they're not serving.
I think during the COVID pandemic, which we're still in, we identified a number of health inequities related to people who did get sick. And if we can kind of borrow from that lens and apply it going forward, we'll at least have come from a position of learning on how to approach these and what we've missed even during COVID. This is a significant area, and that speaks to my original statement on vulnerabilities and who are the vulnerable, and how can we help them get out of that vulnerability status if we can, or how can we actually help them cope. So yeah, we can learn a lot from the COVID pandemic.
Totally agreed. And I think one of the things that I think about when mapping is that overlay of high COVID rates and low income and racialized communities that I'm sure many of us have seen. And just to add briefly, and John will let you ask more questions, but in the conversation about desiloing, one of the things we've been talking a lot about, Cape, and my colleague Jane and I just put out an op-ed about it this week, actually, is desiloing the climate and toxics conversations, and desiloing this current effort to reform the Canadian Environmental Protection Act from the climate work about emissions reductions, because SEPA, the Environmental Protection Act, is climate legislation as well, but also is so critical when we think about vulnerabilities, toxic exposures, health in so many different ways that intersects with climate. And for those less familiar, since I know this is a climate talk that you've all come to, that SEPA was last reformed in 1999, is supposed to be reformed every 5 years, has just been pushed and pushed and pushed back over and over again. So even, in our de-siloing effort, want to give a little moment to the need for SEPA reform and encourage those interested in climate and health to take a look at what needs to happen and be in touch with your members of parliament about the need for this reform. There was a bill introduced in the spring that now needs to be reintroduced, unfortunately, but it's really key health legislation and climate legislation, even though so often I think we think about it as about toxic protections and that kind of thing.
So one area that I think sits really nicely at the intersection of a lot of the themes that have come up here, which sort of climate and toxics, thinking a lot about vulnerabilities, one of the large themes around health equity that I know that Helen mentioned in the chat, and that's come up a few times here, as well as the need for data and building popular support. The example that keeps popping into my mind, and thank you to Kim in the chat who inputted the Ontario coal phase out as one of these big standout examples, is it's often cited as this big success story for thinking a lot about the health benefits of taking action and helping build build popular support for what is still the largest mitigation effort, GHG mitigation effort that's happened in North America up to this point. Now, I know that folks either sort of were or were not involved in that in some form or another, but I think any big successful example, there's a lot of lessons that can be learned, and there's a lot of examples of things that worked really well and things that we learned a lesson and we subsequently iterated on it next time. So I was wondering if anyone had any examples or thoughts about what worked really well in the campaign to sort of integrate health considerations to phase out coal-fired electricity generation in Ontario. And have you seen any of those lessons either taken from the theoretical perspective or the practical one that have been subsequently applied elsewhere?
I'll kick it off actually on this one. I have to say this is one of the greatest examples of it. It was one of the first examples in my long career in the environmental field where the business case analysis didn't sit in its siloed approach. Like coal was the cheapest for the province of Ontario to generate the electricity. They were like, that's the cheapest way for us to generate the electricity, but they weren't thinking comprehensively. They didn't also realize that implications associated with the burning of that coal end up on their public health bill budget. And bringing that together, it was identified like, okay, so there was an analysis done that if we remove this much of air pollutants from the system, what does that mean to our healthcare healthcare costs over the long term? And in many ways, when the Ontario Medical Association came out and found that air pollution Ontario is costing the healthcare system, we're not looking at the costs of lost lives and lost productivity, which those numbers don't seem to quite resonate quite as much with public officials as this is costing our air pollution problem is costing our public health care budget an amount to the tune of almost $500 million on an annual basis. Now, when you bring that into your energy planning, you have a very good, solid rationale for the health benefits that are accruing to those energy decisions. And that's where I think that was one of the first examples in my experience of where those silos got broken down, and it helped to build the value proposition for this as a provincial policy. And it's made a huge difference.
I'd just like to make a comment on the coal phase out from a health perspective. Before COVID, the data showed that of the top 5 health hospital admissions, 3 of them were cardiovascular and respiratory. And that's before COVID. I'm sure it's higher now. But on the respective of climate change and the health impacts, those concerns, cardiovascular and respiratory, are also the ones that are expected to increase during climate change. And so we're going to have an increase in these types of diseases based on both historical and going forward with the climate change. So it's going to be major changes possible in how we're delivering our healthcare system services. It's something that I think hasn't really been looked at in much detail. How are we going to prepare our health systems to deal with this? Great to reduce all the impacts that we can, to reduce the vulnerabilities in the population. But I think going forward, we still have to deal with these as issues. And I think somebody pointed out forest fires are one of the major particulate sources right now, and that's going to increase. So it's a strain on the system that we haven't really begun to explore.
If the Ontario coal phase out predates my time at CAPE, so I'm appreciative of my fellow panelists, and also Kim Parada, who is in the chat, who was the director of CAPE, providing some insight into this. I might just add, I chatted with some folks at CAPE who were involved both in the Ontario and Alberta coal fights, and one of the interesting, they also kind of emphasized this point that I think is to an extent CAPE's bread and butter, and though I think we all try to mobilize around the use of trusted messengers. Physicians were increasingly working with nurses, with the Canadian Association of Nurses for the Environment, who, when, you know, in polling shows, are actually even more trusted than physicians. So that's also wonderful to have that partnership growing and have such wonderful nurse-driven advocacy happening in Canada. As well as in Alberta, there was that they costed out that there was a $3 billion cost to in the health system as a result of air pollution. So really speaks to Linda's point about the extent to which a health argument and the health systems argument is really central to making the case. Another thing that I found interesting that again, I'm just passing along information, but I thought was worth passing, is the argument in Alberta in particular around the need for just transition worker, but different plans, new plans for workers as part of making the transition, making the case out of coal, which to my understanding, and maybe Gaby and Linda could speak to this, was a little bit less of a central focus in Ontario because it was a different sort of workforce. Like the coal wasn't mined here. There's, you know, fewer people involved in terms of the workforce, but the need to account for worker transition as well, and, you know, starting to think about worker well-being and having stable work as part of our vision of success in when we think about climate and health in the future. I think thinking about a healthy transition for workers is an interesting case that I'm sort of newly thinking about exploring to bring to the labor-driven conversation about transitions.
In one of our, sorry, Gaby, go ahead.
Just following up on that, the economic development, the job creation opportunity was also really, really important in the Green Energy Act as it was advanced in Ontario, because during that time period, Ontario had been decimated by the kind of, you know, the economic downturn in the auto industry, and Ontario has a huge kind of auto connected sector in terms of job creation, job employment in Ontario. the province recognizing that kind of like, whoa, we have a potential for some serious employment issues occurring from the downturn in the auto sector in Ontario. And they're thinking at that point in time, and it was one of the reasons why they required manufacturing to take place locally, even though they probably knew that that was not going to be maintained with the World Trade Organization. But it was geared towards getting a new economic development opportunities with relating to renewable energy here in Ontario to help address the economic downturn in the auto sector.
That's really interesting. And one of the big things that I kind of want to cycle back to a little bit is you mentioned, Gaby, a bit about how some economic statistics like lost productivity from poor air quality don't resonate quite as much, which makes sense in some cases. Productivity can be sort of a bit ambiguous and hard to pin down. But coming back, I think, to the sort of health and climate intersection quite notably. I know you all work with and have had careers with organizations who've sort of worked at the intersection of this space. But in thinking through sort of who the loudest and the most influential voices have been in the room and sort of thinking about the intersection of these issues so far, who have been the most impactful? And perhaps more importantly, who do you feel needs to be brought into the conversation moving forward if we want to continue to build on the progress we've seen so far on this file?
It's the stories. It's the stories that come from the people that are being impacted. In Ontario, we may not have seen the impacts that we see in BC or in other areas, but as soon as there's a disaster, we start to take notice and we start to react more. So I think it's the stories that are really impactful and bring situations to life. And it's not happening around, farther around the world, it's happening in our country. So I think that's part of what I see out there. What I would love to see more part of the conversation are senior leaders in health. And that has not happened a lot. And taking the perspective that this is part of their mandate as well. Health leaders have so many priorities, as we know. It's really hard to get this in there. But if there's a disaster on your doorstep, you're going to notice. And until that happens, in a lot of cases, we will see that be a lot more slower in uptake than we had hoped.
If I can, I'd love to kind of give an extra oomph to Linda's mention about getting senior medical names into the conversation, because it resonates. They're trusted advice, like they're trusted they're a trusted sector, they're trusted people. Having them be part of the conversation would be amazing, because it would be something that really does draw attention in ways that, no one's surprised when David Suzuki's supporting these things. But when you have a chief, medical officer of health from either an organization or from a jurisdiction, that resonates with people. People trust their health advisors. And the other one I would have to kind of say is the economists. Enough with the economics 101 as they're like where they start out in terms. That's fine to start out at economics 101 with your traditional cost benefit business analysis, but the small silos they put around their work are fundamentally hurting the way we need to move forward on climate change, which is about integrating benefits from different areas. We can no longer afford to look at things in our silos. We have to look across these silos and find ways to get synergies across them. And we need economists to help put those business planning strategies and analysis to do that, so that we can build that integration across sectors.
Yeah, that also makes it a ton of sense to me. I think the only thing I would add is, we have seen the potential for the physicians that I've worked with over the past couple of years at CAPE to be able to get into spaces that are hard for example, environmental NGOs like the Suzuki Foundation or other spaces to get into, because we're saying, it's an ER doctor, come let them speak, come let them testify at committee. For example, so we had a couple of physicians testify or brought in as witnesses to committee when Bill C-12 was being debated, the climate accountability legislation, and it was done in such a short time that there were very few witnesses. So, and we also have, we have really good success with media, because the people writing the op-eds or being offered for interviews are physicians or nurses. So I think, use of those trusted voices, agreement on more senior leadership for sure. Although I think I feel like it's increasing. I feel like there's some room for optimism there. And then the other thing I want to add, which I think comes back to our points about vulnerabilities and justice, is that, there's so many, if we lean on the existing group of physicians, for example, at CAPE, which is a physician organization, to say, you're the people, we should put you out front, et cetera, we risk just leaning on the existing hierarchies. And again, and making asks over and over again that just prop up those same systemic hierarchies. So I think when we're thinking strategically about who messengers should be and who the trusted voices are, we need to know what we're doing when we're doing that we're playing within the system. In a sense, we're trying to make change within the system by using who is a trusted voice currently within the system, and have really good analysis about what we're doing, and be in close touch with people who are more vulnerable in the systems, which doesn't not necessarily go hand in hand with having a kind of high on the social hierarchy trusted messenger. So that's something I think about. It's something, we're working on at CAPE, and certainly not doing perfectly, but wanting to make an effort to make sure that we're aligned with broader principles of justice.
And as a quick follow-up to that, I think we've got a question in the Q&A that I think is quite relevant for this from Tom. And I think his question was around what the role is for public health professionals, and talking about sort of the impact of climate on citizens' health and sort of communicating that externally. Do any of you folks see sort of a key role for public health professionals getting more engaged in the space, or do you feel as if there's already a lot of battle being fought there?
Ooh, this is a huge area for them to be involved. Absolutely. Helen Doyle is on the on the chat, I see. Health Canada has a program called Health Adapt. And in that program, public health agencies, as well as health authorities and other health infrastructure organizations are actually undertaking vulnerability assessments. And so public health often leads that in their communities. And that's a huge role for them to take. I also see, for example, I think this happened in one of the Northern Territories, where the chief public health person was vocal about climate change. And we don't see a lot of that. Yes, they're speaking out about COVID, but I think now we need to engage that leadership as well in speaking to the climate issues. So when I spoke about leaders, I know that doctors are doing a great work through CAPE in that. I'm actually thinking about the leaders that are higher up, the CEOs of hospitals, the ministers of health. We should have mandate letters in the ministers of health portfolios about climate change. We should have that as well in the mandate letters of the chairs of all the different health authorities. This will bring an an opportunity for the health system to actually respond to the climate crisis in a lot more structured way. We don't have a lot of that. It's starting to happen in BC. I don't see that in the rest of the country. A couple of examples.
I can just say what Linda said.
Yeah,
And
agreed.
what we also need, I think, at the top, at the federal level, is an agency dealing with climate and health. We have a problem in that we have provinces and territories that lead their own health systems, and we don't have a structured approach across Canada. But if we had an organization that was focused on climate and health at the Ministry of Health level, I think this would help tremendously, and it would bring profile. The thing that got the US President Obama, when he was in power at the time, to come forward and deal with the climate issues was a disaster. California, Texas, New York all had huge flooding problems with the hurricanes. That's what created the movement going forward. Are we going to wait for that to happen? I mean, we're already seeing issues in BC. Are we going to wait for all these disasters to happen before we actually put in a structure in place that can help us deal with this better? Sorry, my rant.
If I could just follow up with Linda, I think one of the things we have to also realize, in addition to the kind of the intersections between the silos, like let's face it, our Western society has been able to make huge advancements because we've specialized in our silos, and it's worked for us for a period of time. But I think right now, moving into the future, it's the integration and synergies across our silos that are really going to be where we have to put a lot of our effort. Because if you think of the BC experience, they were one of the first provinces, I mean, outside of probably the northern provinces, which were definitely getting, a lot of hit in the territories because of the huge temperature changes. But in BC, they had the mountain pine beetle come into them. That mountain pine beetle decimated their coniferous forests. And the reason the mountain pine beetle was able to make an inroads into BC now when they weren't able to make it before is because the less intense winters and the lack of the cold enough temperatures in the winter for enough period of time to kill the mountain pine beetle moving forward. Then the forests get decimated. Then we have then lightning strikes or other things happen, and those mountain pine beetle infested forests are tinder boxes. They light up on fire. You lose those forests, you now have exposed ground that when precipitation comes, turns into mudslides. And the connection between them is something that we all got to we all have to up our game on that to understand how these interplay with each other. And that will allow us to act on our synergies moving forward, and recognizing the interplays and how work we do will also affect other sectors.
Absolutely.
So I have kind of one final question of my own, and then I think we got a host of audience questions that I want to ensure that we get to in these final few minutes. So the discussion of public health officials drawing in senior leaders, thinking more about economists in the business community, there was a notable omission, I guess, on my side, which was that we talk a lot about the importance of health equity and engaging community members in sort of championing for themselves. And maybe this is one of those divides that can be attributed between the importance of the stories that we tell and the voices that tell them. And in that gap, I guess one of the areas that I think a lot about is, are there, from your perspective, are there challenges in bringing more community voices to sort of champion for action into the debate in a meaningful way? And have you ever seen that done really successfully in the past?
If I can try and answer your question,
Sure.
But also try and address Heather's question, because I think this might be an example of that shows that. Her question was, what role do you see municipal planners playing in the intersection of health with climate change? And one of the projects that was really near and dear to my heart that I was at the Clean Air Partnership through the Clean Air Council was there was some I'm missing the word, but where staff people from public health were going into planning and secondments, that's the word. So there's some secondments between public health and planning, and some planners went into public health, and that had allowed them to kind of go across their silos. What came out of that is actually Peel Region developed the Healthy Development Index that helped to kind of bring those synergies from a public health perspective, but also from a planning perspective. How we all understand how we build our communities are going to determine how we get around or the health outcomes that we achieve. But bringing those two departments together and getting those relationships and developing methodologies for that bring the synergies together resulted not only in the Healthy Development Index, but that also moved towards green development standards that rank out where development and how development will occur, and what are the health outcomes that and environmental outcomes that we're trying to achieve with our development, and how do we advance those outcomes, and how do we track the progress towards those outcomes. And that's an example of how I think that marriage between, or the matchmaking between public health and planning is an example of the different silo busting that we need to do.
That's a great example, Gaby. The other one that I'll bring forward is from Fraser Health in BC. They developed a climate vulnerability index. They created maps of where the vulnerabilities would occur in those regions. So they worked in the municipal communities, but within the health regions. And so they were able to identify where those climate vulnerabilities were, and engage the population based on that. So I thought that was a really interesting piece of work too, if you haven't seen that. There is Fraser Health.
Yeah, I mean, I think the broader thought that I'm having, and it's nice to have some specific examples, is that, you know, I'm situated in an NGO. NGOs are pretty bad at doing this on the whole. Like, I think environmental NGOs in particular have not on the whole been great at really engaging with most vulnerable communities. And I think there's many reasons for that. I think the systems that fund us are a big part of it. Our narrative about urgency is, I think, a big part of it, and not to, I guess, dispute the urgent nature of the problems we're facing, but that when we operate assuming maximum speed at all times and a need for decisions to happen really quickly and, you know, really fast turnaround and that kind of thing, those kinds of processes are not very well suited for good engagement. So there's some default ways of operating in many of our spaces that I think would need to be overturned to have good examples of community engagement, which have now been given. And then we're also, you know, we're part of, it was recently renamed, so now I'm trying to blank a little on the name, but I think something like the Canadian Coalition for Environmental Justice, which Ingrid Waldron and Nello Charles are engaged with. And I think that's a nice example for thinking for a national example of a coalition that is clearly driven from a community impacts perspective, from an environmental justice perspective. And it was founded by people really engaged with that framework, so that when the health orgs and environmental orgs joined in to that space, the framework was created within a community-oriented justice perspective. It wasn't an environmental NGO or, you know, a sort of within the system kind of organization trying to like intervene on its own self. You know, it was the framework was set up in a way that was really supportive for community-driven work. So I think that's been a nice example and in a more sort of organized, multi-organizational space. But yeah, it's for sure tricky. And something I think many in environmental spaces need to work on. Although I will just briefly say that that's something I'd been focused on for a long time, the sort of coalition building across organizations. And one of the reasons I was so excited to come to CAPE, and has completely been true, is that having health as central to this conversation about whatever the environmental issues, so we're talking about climate today, opens huge doors in my mind for really rooting the conversation in community level impacts. So I think there's a lot of power there that organizations rooted in health can bring to environmental conversations more generally.
If I can just follow up on Anjali's point as well, I think one of the things that the environmental kind of movement has learned in this is like we were still naive for a very, very long time, thinking that information will actually change people's behavior. And we really didn't, it was hard for us to accept that it doesn't in reality how things occur. So I think one of the key areas that I think is really important is like when we're engaging with the community, it can't just be for information purposes. We've got to kind of figure out what change do we want them to make, or what change do they want to make, and how can we help them make it, and how does that connect it up to climate. I'll use an example on this one. And like, you know, we've been talking when giving information to residents about how to do their home energy efficiency retrofit programs, or how to reduce flood risk across their communities and across their homes and for themselves. Enough with the information. We really have to get programs that help people move from taking that information and acting on that information and achieving the outcomes that we need to do. So I kind of see it as not so much that we're going to be doing education for education's sake, but we're going to be doing education to try and drive behavior and uptake to the measures that we know we need to achieve to reduce our kind of risk and vulnerability to climate risks, as well as reducing our GHG emissions that we play a role in. But where I think it's particularly important in community engagement is helping people understand, because while they can do a retrofit program for their own house, if there's programs to help them, they don't play a role in understanding. They're not the ones making the decision on how our electricity is generated or our expansion of natural gas pipelines. They're not making those decisions. Those are systemic issues that our decision makers make for us. But I think helping people understand the systemic changes that need to happen to help us achieve the outcomes that we need to achieve is something that we do need to kind of put more emphasis on.
I love that point. And as much as I wish we could really continue this conversation on for another couple hours, we unfortunately are coming close to the end of time. So right before we go, I wanted to ensure that we got a chance to sort of kick off with one final question that the audience brought forward. So Tom asked about, Tom referenced the annual studies that the Lancet puts out on some of the health impacts of climate. They're great, they're really accessible. I know that CAPE has a ton of resources that are designed to be really accessible, specifically overviewing some of the health impacts of climate change and the health benefits of climate action. Really briefly, in some of your concluding thoughts, what are some of the studies that you folks reference and that you might want to point to for future work?
Just on that note, I think Lancet is doing a call out for climate and health papers. That's what I just saw recently. So that would be anybody on this call can.
I was going to say you're definitely speaking to the right audience.
I do work in conjunction with the World Health Organizations, and there's a number of reports that they put out to help the transition to a sustainable, resilient climate health system. And so there's a number of reports that have come out from the World Health Organization there. And there's some great reports out of the NHS in England that I reference quite a bit as well.
I'd give a shout out to the Ontario Public Health Association as well for the work that they've been doing. I've got a lot of my research from them as well. And I think it's kind of like translating the information that's available and helping to bring it to a kind of Ontario context that I think I find really, really helpful.
Yeah, I think one thing I can add is the couple of longer case studies that have been written up on these coal fights, and I linked one shorter one in the chat, and from there you can find a couple of references to some case studies put out by the ISD, I believe, on one on Ontario, one on Alberta, which I think are really interesting to dig into. And the other thing, that I just want to briefly take a moment to promote to this audience is and including public health in this as well, is we're about to launch a mobilization and training program on advocacy for health professionals, so doctors, nurses, anyone working in health, and that if that's of interest, I'd encourage you to kind of keep an eye on the CAPE social media or email list or website. We're going to launch it in the coming months, and one of the things that will be part of that is a resource list. So our resources should be better organized on the website, the resources we use in addition to the ones we produce. But yeah, I'm really excited about this project, and I'm hoping it can really increase the capacity of people working in health to engage with these issues really effectively.
And with that, unfortunately, I do have to call the hour. Thank you so much for an incredibly stimulating discussion. I certainly learned a lot. I see a great deal of engagement and thank yous as well on the chat. So thank you to John, Anjali, Linda, and Gaby for all of your insights. And thank you to everyone for continuing to be very, very engaged and for sharing all the great resources. I invite all the participants to, look at our previous events, which I think the webinar recordings will be shared in the chat. Please read our reports and feel free to complete a post-event survey to let us know what you thought. Thanks again to everyone, and take care. Have a good rest of your week.